I'm speaking on behalf of my whole team with whom we have designed this project, which is entitled, as you can see, Challenges and Opportunities of Partial Integration of Ivermectin Mass Drug Administration into the Cameroonian primary healthcare system. And first of all, the background of this project is that there are about 21 million of people infected worldwide with onchocerciasis, which is among the neglected tropical disease. And 99% of these people are living in African countries. And the main problem with onchocerciasis is the serious socioeconomic and survival impact the disease has on the populations that include epilepsy, loss of productivity, excess mortality, and so on, which are associated with epilepsy. And pardon? Okay, sorry. And the community-directed treatment with ivermectin is an effective strategy which is recommended by WHO to fight against onchocerciasis, and which have led to elimination of the disease in some countries. In Cameroon specifically, despite more than 20 years of drug distribution in campaign, onchocerciasis is still endemic in 60% of health districts, with the prevalence which is above 60% in some districts where the drug have been distributed. That is mainly in the center region, the littoral, and the west region. And it should be specified that the disease also affects all the age groups, including children below 5 years. And the gap we identify in this problem is that there is a poor drug coverage, which is observed at the end of campaigns. And among the main reasons of that poor drug coverage, there is the absence of people during the campaign, because some of them are going for farm activities for weeks and even months. And if that happens during the campaign, they will not be available to take the drug. And secondly, community drug distributors sometimes fail to deliver the drug to household. And there is also a top to bottom planning of the campaign, which may not consider the specific realities of each region or each district, and all those elements lead to poor drug coverage in some districts. So the idea we have is that partial integration of ivermectin drug distribution into the primary healthcare system with a continuous delivery of the drug after the campaign to those who were not present or who could not have the treatment may overcome the implementation gap of this intervention, which have been proved to be effective. And it is in that line that our aim here is to evaluate challenges and opportunities which are related to a partial integration of IVM distribution into the primary healthcare system. And this evaluation will involve all the stakeholders at various levels of the primary healthcare system, including the Ministry of Health, the regional delegation of the regions that have been selected, the health districts, the local health workers in those districts, and mainly the communities member which have to be involved in the process to ensure the success at the end. And as outcome, the results of this study or this project will be used to design an integration model and plan for that will be suitable for the Cameroonian system. And the following aspect of the integration into the primary healthcare system will be investigated during the project. That is, first of all, the system, that is the overall project or the overall system of drug distribution, including governance and leadership, including planning and financing. We will also investigate the inputs of the campaigns and even the integration, including the workforce, the information system, the drugs and supplies. And lastly, we will also evaluate the service delivery, including the demand generation and the community acceptability of such an integration into the primary healthcare system. And this data that will be gathered will inform further trials to assess the effectiveness of the integration prior to the generalization to the whole country or to other regions. Our primary research question here is, what are the challenges and opportunities of a partial integration of IVM mass drug administration into the primary healthcare system? And to answer this question, we will use a qualitative research design mainly with in-depth interviews and focus group discussion at central, regional, district, and communities level. And we will use the evaluation framework, which is the consolidated framework for implementation research, which have been modified specifically for African countries. And the second question here, what is the cost effectiveness of ivermectin mass drug administration through campaigns? This will mainly be a quantitative research method where we will collect data of the last ivermectin campaigns in the targeted district, and those data will concern the cost of the campaign and the drug coverage at the end of the campaign. And we will use it to assess the financial delivery cost per intervention dose delivered. This will be the quantitative aspect of the project. And the timeline that we have for the moment, we have requested for the ethical clearance, and we are expecting to have it by the end of July latest. And from there, we will begin with data collection in September this year with about 16 interviews at central level, 10 interviews in region, 40 in districts, and 60 interviews in the communities with 20 focus group discussion. And quantitative data will be collected for the recent campaign from the 62 districts of the 5 regions which have been selected for this project. And after all this data collection, we will do the data transcription and analysis by January. And after the data analysis, there will be a deliberative forum with all the stakeholders where the results will be presented, and we will discuss with them to share the results and to have their inputs and adjustment on those results before the writing of the final report of this research. And the main challenges that we can observe in these projects can be, first of all, the difficulty to access some rural area where the roads may not be practicable. And for that challenge, we are intending to use a private four-wheel drive car, which will be adapted for seasonal rains. And there is also the restrictions which can be related to COVID-19 pandemics, which may delay some field work. But so far here in Cameroon, we have never been in complete lockdown. I will observe all the preventive measures against COVID-19. And our planning also allow us to have enough time to catch up in case of any delay. So thank you.